Hi, in this video we will be talking about pharmacokinetics, that revolves around how a drug is metabolized in our body. To be more specific, the absorption of a drug, the distribution, the metabolism, and the excretion of the drug. The reason why I decided to make a video on this topic is this is a good transition from learning biochemistry to transitioning to pharmacology. So this is how the biochemistry is applied in pharmacology, and at the same time we'll get to know how these drugs are affected in our body once we take it. And it's also very crucial because this changes a lot of things when it comes to dosing the drugs or when it comes to administering drugs in certain ways, and specifically for different drugs, how do you administer it and what are the doses you give. All those things can be answered if you understand the pharmacokinetics of a drug. Okay, so let's start with absorption. So what's the absorption? It starts from the site of administration. So let's say you give the drug orally or through IV or through intramuscularly or through subcutaneous or topical, like your sprays or anything. Those are topical, like creams, all those things. So it starts from the site of administration, and from the site of administration to reaching the bloodstream. That is called your absorption, which is pretty basic, right? Now, but there are many different factors that affect the absorption of a drug. So let's take oral. If you're giving an oral drug, the drug has to pass through your gastrointestinal tract, right? Your stomach, your small intestine, and then it has to get metabolized over there and get absorbed by your bloodstream. So that's a longer route. But if you're going to give drugs through IV intravenously, that is directly to the blood in your veins, that means that the drug is going to reach the circulation sooner. It's going to bypass the gastrointestinal tract and reach the blood sooner. Right. Similarly, for IM, subcutaneous, topical, each have their own factors that affect the absorption. Now, there are some specific things that about the drug and the environment of your site that affect the drug's absorption. Those are the form of your drug. So let's say a drug is in the form of a pill, or let's say the drug is in the form of a liquid like syrups or something, or let's say it's form of a gel. Okay, it could be anything. So the drug form is a factor that affects how fast the drug can be absorbed. Next would be the solubility. Is the drug lipid soluble or water soluble? We'll be talking about this more later in this video. Lipid or water soluble, and of course the pH of the environment. So usually when you take most of the acidic drugs, gets easily absorbed in acidic medium. Same for the basic drugs, it gets easily absorbed in basic medium. So acidic drugs, which is an acidic medium in our body, your stomach has an acidic medium, whereas a comparatively basic place is your duodenum. So there are certain drugs that can be absorbed easily in the stomach. Those drugs are acidic drugs, whereas certain drugs are basic, so they get absorbed easily in the duodenum because duodenums have a alkalotic environment. Right, so these are all the factors. Now there's another important concept called first pass metabolism that happens for your oral drugs. So what happens when you take oral drugs? As I said, it goes through your GIT, right? And after GIT, it goes through your liver to get checked for any toxicity, or to get to check if the drug should be excreted or should be used. We'll see more about that in the metabolism part, but I'm just giving you an idea here. Oral drugs, they go through the GIT, then to the liver, and then to the systemic circulation. So by the time the drug passes through all these routes, the dosage of the drug decreases. So the drug that you took orally, let's say you took an X amount of drug, or let's say you took 100 mg of drug, and the dosage or the effectiveness of the drug when it goes through all these systems is going to reduce, right? So that's called, that phenomenon is called your first pass metabolism. Now if you take IV route instead, you will not have this first pass metabolism because the drug is bypassing all these routes. Instead, it's directly going to the bloodstream and from the bloodstream to the target organ. Okay, so these are all the important concepts that you need to understand when it comes to absorption. Now, what about distribution? So absorption was from the site of administration to the bloodstream. Now distribution is from the bloodstream to the specific organ or tissue that you want the drug to reach. So now that is dependent on three important factors. Those factors are your blood flow, binding, and your solubility of the drug. So there are certain organs in our body that have very high blood flow. So the drugs are always going to prefer organs that have very high blood flow, because obviously most of the blood is going to those organs, right? So some of those organs are your liver, kidney, and your brain. Okay, so any drug you give, that the drug is going to try and reach the liver, kidney, and brain, because the blood flow in these organs are very high, because these are vital organs. Okay, when it comes to brain, there's another factor involved called your blood brain barrier, about which we'll be talking soon. Okay, now what about binding? This is a very important concept. This decides if a drug has a very short term effect or a long term effect. Okay, mainly drugs bind to protein in our blood. Okay, and the main protein is albumin. So let's take this is a blood vessel. Okay, and this purple thing here is the albumin, and this orange thing here is your drug. So now, and let's imagine that the tissue is over here. Okay, the drug has to reach the tissue. So now let's imagine the drug is bound to albumin. Okay, if it's bound to albumin, it's difficult for the drug to escape the bloodstream and go to the tissue. So that means the drug is going to remain in the bound form for a very long time in the body until it gets unbounded. Okay, but whereas take this case, the drug is not bound to the albumin. So that means these drugs are going to go and act on the tissue immediately. Right? So from this, what can you interpret? You can interpret that drugs that are bound to albumin more easily tend to stay in the bloodstream for a longer time. For a longer time, giving long-term effects. So that means the drug doesn't wear off very easily or get excreted very easily from the body. But whereas the drugs that are not bound to protein are going to act immediately, and they're going to give you short-term effects. Right? So this is very crucial to understand. Bound to protein and free drugs. So this is your bound, this is your free drug. Okay. Now what about the solubility part? There are drugs that are fat soluble. Okay, so you know the cell membrane is made up of phospholipid bilayer, right? So it is easy for fat soluble lipid drugs, the drugs that are coated by fat, to enter the cell more easily or enter through barriers easily. Now one classic example for that is your anesthetics. Most of the anesthetics are fat soluble, and hence they can cross the blood brain barrier very easily and very immediately and show its effect on the brain, hence making the patient feel the effect, okay, of anesthesia. So that's why anesthetics are mostly lipid soluble, fat soluble, and that's why they're able to cross the blood brain barrier very easily. Now these are all the concepts that you are required to understand about distribution. Now what about metabolism? So the metabolism of a drug primarily takes place in your liver. Okay, so there are two phases to this. The first phase, the drug reaches the liver and it gets oxidized, reduced, or hydrolyzed by various enzymes depending on the drug. What does these processes do? They make the drug more water soluble. And why is the body trying to make the drug more water soluble? See, how do we primarily excrete drugs out of the body? We primarily excrete drugs out of the body through your kidney, through urine, right? And if it needs to be excreted by urine, it needs to be soluble, right? Water soluble, so that it can get filtered and so it can go through the nephrons and get filtered and pass through the collecting ducts and go out as urine. So to make a drug get excreted, you need to make it water soluble. And why does the body wanted to make the drug as water soluble? Because drugs are classified as xenobiotics, if you remember from your biochemistry. These are outside chemical particles that are entering our body. So obviously our body will not know which is good, which is bad. All it tries to do is it tries to inactivate it, it tries to make it water soluble so that we can flush it outside our body. Okay, that is the reason why the drug is being hydrolyzed, or it's being made more water soluble in the liver through various enzymes. Now, after that, there is a step 2 called conjugation. In this, there are different molecules added that make the drug even more water soluble. Okay, they make it even more water soluble so that the drug can be easily excreted. Now, you might ask, if the liver is going to make all the drugs water soluble, when is it going to go and act on tissues? Right, so that's where the picture of lipid soluble drugs and all the other factors come in. Okay, so what I'm trying to explain here is the phase 1 can inactivate some drugs. Okay, not all drugs are inactivated by increasing this water solubility. Some drugs are activated, but phase 1 obviously can inactivate some drugs if it makes it very water soluble and it becomes easily excretable from the body. Okay, sometimes phase 1 and 2 both needs to act to activate some drugs. So it's just a probability, anything could happen. Phase 1 can activate some drugs, phase 1 can inactivate some drugs. Phase 1 and 2 can inactivate some drugs, phase 1 and 2 can activate some drugs. Okay, so that's how the metabolism is. But primarily the liver, you should remember that the liver always tries to make your drugs as water soluble as possible, so that your kidney can excrete it as urine. So from the liver, before entering the kidney, if you need a better understanding, from the liver, before the drug goes to the kidney, it has to go through the systemic circulation, right? And then after kidney, then urine. So this is the part where before the drug reaches the kidney, it goes and shows its effect through the systemic circulation. Okay, now if it's extremely water soluble, then this is having a high chance of bypassing the systemic circulation and acting on different tissues, instead directly going to the kidney. Okay, so it all depends on what kind of drug and what are all the factors involved. Okay, now here this is a good time to talk about the first pass effects. Now remember, as I told, the first pass effect is for drugs that are taken orally. So the oral drugs go through the GIT, then to the liver, and then to the systemic circulation, right? So they have a higher chance of going through phase 1 and phase 2 reaction. Whereas when you take IV drugs, they directly enter the systemic circulation, hence they do not go through all these phase 1 and phase 2 reactions. Okay. Now to the final part of this discussion, excretion. So primarily the drugs are excreted through two major parts, kidney and your liver. And there are some other less common routes like your sweat, breast milk, and through exhalation of carbon dioxide, through exhalation and all those things. But kidney, as I said, urine, water soluble. Okay, liver through bile and your feces. Some drugs are put in the bile, and the bile, what happens to the bile? The bile is present in your feces, right? So it gets excreted as your feces. Now another important fact to know here, a term that most of us get confused, is half-life of a drug. What does it mean? It's simple as this, guys. Half-life means time taken for half of the drug to be eliminated from the body. Okay, so time taken for half of the drug. So let's say a drug has a very short half-life. That means the drug will be eliminated very easily from the body, so it has a very short-term effect on the body. But if the drug has a very big half-life, so that means the drug is going to stay in the body for a long time and it has a long-term effect. Okay, so these are like basic concepts that if you just even think about it, you will be able to understand. But these are very crucial at the same time, as I said before, to understand how drugs work in our body and how different classes of drugs must be administered in specific routes, considering different factors that involve in the metabolism and excretion of drugs. So finally, what are the factors, common factors affecting ADME? It could be age. An age of a person could be affecting the ADME of a drug. The fat percent, okay, of a person, the fat percent, the the amount of adipose tissue in a person's body can affect the factors. Can affect the ADME of a drug. The kidney function, if the kidney function is deteriorated, then that means there's a chance that water soluble drugs have lesser chance of getting excreted, and hence there is toxicity in the body. There is accumulation of drugs, accumulation of byproduct of drugs. The liver function, if the liver is not able to make the drug more water soluble, then that means the drug is going to be toxic again. So if there is liver failure or kidney failure, all those things has to be taken into account before administering the drugs. And finally, genetic factors, because remember, genes are the ones that produce proteins, right? And you have your enzymes, which are proteins, made up of proteins. So these are the enzymes that catalyze the phase 1 and 2 reaction that we saw in the liver. So obviously genetic factors and how a person's gene influences the presence of an enzyme also plays a big role in the ADME, specifically the metabolism of a drug. I hope this video gave you a really good idea on how drugs are metabolized, how drugs behave inside our body. So now just take these concepts and apply it anywhere else you go in pharma, so that you get a better picture on where to apply what drug and what kind of routes you should administer the drug in. What are all the factors that you should take into account before starting a drug, or to decide the dosage of the drug. Thank you so much.